The detectives continue investigating Charlie, and when they try to talk to the Aloysius Hospital's attorney, he tells them that their staff's information is strictly confidential. They are both frustrated that every time they try to approach Charlie, there is always someone who has his back. At that, they receive a package from Parkfield Memorial Hospital's internal investigation. Baldwin talks to Linda and asks for medication reports obtained through the hospital's internal system, but she tells him that the reports are only stored for up to 4 weeks. However, after some investigation, Baldwin believes that Linda is hiding evidence, but she prefers to set the matter aside and ends the conversation. At this, Baldwin loses his temper and yells her to sit down. He calms down and berates Linda for what she is doing. Amy sees a new patient named Kelly, whose husband admits to bringing her baby Vanessa to the hospital, but Amy lets it go. Charlie shows up and tells her there's a purple code, which means the pizza arrived. Charlie tells Amy more about his crazy ex-wife, who tries to turn his daughters against him. Detective Baldwin tells his partner that he had access to Anna Martinez's medication records and noticed how there was not only insulin on it, but digoxin as well. At that, his boss appears and mentions how they are both banned from the case because of Baldwin's behavior toward Linda. When the detectives complain, their boss tells them that since they don't have a body to investigate, they simply don't have enough evidence to proceed. Amy sees that Kelly can't remember her own baby's name, so she begins to notice that Kelly is starting to faint. She calls Kelly's husband to come as soon as possible, notifying him of the unexpected. While checking the patient's condition, Amy sees that Kelly has insulin in her system, rushing to attend to her as she convulses. Unfortunately, when her husband arrives, Amy gives him the bad news, and he gives her baby Vanessa so he can see Kelly one last time. The next morning, the detectives show up at Amy's house, and she tells them right away that she has nothing to do with Kelly's case. They are puzzled as they don't know what she is talking about, so they deduce that there was another victim. Amy knows she screwed it up, and they start asking her whether Charlie was involved. They tell her that Charlie has been to 9 different hospitals and that no one wants to talk about him, so he is their prime suspect. They give Amy their card and leave, asking her to contact if anything happens. Amy becomes suspicious, so she meets with Lori Lucas, the mutual friend she has with Charlie.